It's okay. Definitely needs work. I think, you have to wait like too long of a time to get help. I think sometimes the system will help you when you're like really, really bad, but it won't help you if you're like about to get bad. And I don't think that's fair. I think prevention is so important, and I think learning about, mental illness and mental health from a young age can prevent so much.
I'm gonna say not the greatest. I got into the Sick Kids program that I did because I was so severely ill, and I know that a lot of girls were put on a waiting list for almost even like a year. So that year gave them the opportunity to just decline excessively.
It's great if you can afford it. If not, then it's not very accessible. Usually to see like an OHIP covered therapist with a referral from your doctor, the wait list is around 3 to 4 months. So that's not very helpful if you need something right away.
In Ontario, at least, I find that although it can be improved, it's still a lot better than many other places, especially like in the States. There are obviously wait times, but some things are covered under OHIP, and even a lot of just basic benefit plans in work or even in schools cover some sort of therapist or a social worker. So I do think there are gaps in the terms that it's not, mental health isn't treated like a broken bone or a cut on your skin. It's not just X and Y or yes, like black and white.
It's interesting because I've actually seen the mental health care system from both sides. I've worked in research within the mental health care system, and I actually received treatment within the mental health care system years ago. So as a consumer, I honestly had an amazing experience. I was able to receive really good help despite the long wait times.
I also think that it's hard because after my program, after I graduated from Sick Kids, I needed help still. I needed some sort of support. So I went to my local eating disorder program, and they said that I was not sick enough. So how does that work? I'm trying to avoid an eating disorder, but they're telling me that I'm not sick enough to receive the help that I needed.
So, I've seen doctors, I've had to wait, but for me, going to CAMH in the emergency department was really helpful. And obviously I was in a really bad place. I really needed like urgent help, and I knew that I couldn't wait any longer. And so I went to the emergency, and that got me seen by CAMH doctors, and it was really, really helpful. And I think that was like a big life-changing, pivotal sort of moment for me when it comes to mental health care.
I found it to be very helpful. I approached my family doctor seeking recommendations on a therapist years ago, and he was able to give me not only multiple recommendations, but also give me a plan of attack of how to help my anxiety through a physical sense with exercise and eating right and things like that. And and then once finding my therapist, she was immensely helpful in learning how to change my thought process and pull myself out of those cyclical thinking sort of holes that you dig yourself when you're a person that suffers with anxiety.
So I do think there are issues, but overall I think we live in a place where we do have a pretty good healthcare system, so we need to be a little bit grateful that we have that, but there's always room for improvements, and I wish it was treated black and white like a broken bone.
Another thing is that therapy is really expensive. Definitely not fair. I think therapy is so important. I think everyone should see a therapist and have a therapist. And so making that more affordable is definitely important.
Very inaccessible. I'm very lucky because my dad paid for me to go to therapy, but if he hadn't, there's no way I could have afforded it. My student insurance didn't cover any of my sessions. And a lot of my friends who went to therapy had their insurance cover 1 or 2 sessions and then not cover anything at all. And if you know anything about therapy, you have to keep going. You can't just stop after 3 or 4 sessions. And if you're a student, you can't afford $300 or $400 a month to spend on your mental health, especially if your mental health is causing you to not be able to keep a job because you're so depressed or you have such anxiety that you can't go into a place of work and work there full time.
then the other issue is that there are long wait times, so that can also be very tricky. But again, it's a tough situation to be in. But at least we're thankful that a lot of things are covered under general healthcare in Ontario and Canada.
I mean, overall, like, I've gotten meds when I needed meds. I've seen therapists when I needed a therapist. So my experience was okay, but I definitely did notice some gaps, and it can be very frustrating when you're kind of, you know, in the throes of mental illness and things, you know, aren't going so great and you need help right away and it's not available to you. So, I mean, it's been an okay experience. I know that other people have had better experiences, other people have had worse. And so this is just has been my experience, but I've definitely noticed room for improvement.
And now working kind of within the system, I see that a lot of the clinicians and doctors who work in the system are really passionate about what they're doing, and honestly they do a lot to try to help people. However, I think just with budget constraints and other organizational things that go on, it can be hard for them to provide these enough services and these services to enough people, and that's kind of why the wait times are so long. So I've actually seen a variety of mental health care professionals. I've seen a psychotherapist, a clinical psychologist, a psychiatrist. I've also spoken to my family doctor about medication.